Right now, I just need you to get real loose. Get comfortable. Grab your loved ones, or grab your love partner. And if you're by yourself, no worries. Just follow after me. Gonna do the two-step, then cowboy boogie. Grab a sweetheart and spin out with them. Do the hold down and get into it. Take it to the left now and dip with it. Gonna throw down, take a sip with it. Now lean back, put your hips in it. Let's have some fun. To the left now. To the right. Now take your left hand and put it on your side. Gonna roll your shoulders. Do the slip and slide. This next part's my favorite part, cause it's time to shine. Gonna do the two-step, then cowboy boogie. Grab a sweetheart and spin out with them. Do the hold down and get into it. Take it to the left now and dip with it. Gonna throw down, take a sip with it. Now lean back, put your hips in it. It's simple, you can do it. Slide to the left, slide to the right. Now cool down, have a good time. Slide to the left, slide to the right. Do the butterfly, have a good time. Round, round, round and round you go. It's time to show out right now and take to the floor. Gonna do the two-step, then cowboy boogie. Grab a sweetheart and spin out with them. Do the hold down and get into it. Take it to the left now and dip with it. Gonna throw down, take a sip with it. Now lean back, put your hips in it. Take it down now, take it down now. Take it down now, take it down now. Bring it up now, bring it up now. Bring it up now, bring it up now. Take it down and crisscross. Bring it up now, crisscross. Do whatever you like right here. Just have fun. Gonna do the two-step, then cowboy boogie. Grab a sweetheart and spin out with them. Do the hold down and get into it. Take it to the left now and dip with it. Gonna throw down, take a sip with it. Now lean back, put your hips in it. That was not so bad. That was not so bad, was it? That was not so bad. That was not so bad, was it? That was not so bad. That was not so bad, was it? That was not so bad. That was not so bad, was it? Gonna do the two-step, then cowboy boogie. Grab a sweetheart and spin out with them. Do the hold down and get into it. Take it to the left now and dip with it. Gonna throw down, take a sip with it. Now lean back, put your hips in it.
On behalf of the board, I would like to welcome everyone here today and making the time to come. This year has been a year like no other, and this AGM will be an annual general meeting like no other also. Unlike last year, where we had 100 attendees here with us in the room, this year we only have a handful of people here with the rest of you online as we share our journey through this wonderful medium of live stream. The great benefit, of course, is that our coverage today is recorded, which means many who couldn't make it tonight can take a look at the meeting well after tonight's AGM is over. Today's coverage also means that technology has allowed us to reach many more people than we have in the past, much further than our usual catchment. I hope you all enjoy the coverage and the information we're about to share. Now, as you can see, we have a full agenda with two great guest speakers. We are so grateful to have Dr. Ruth Vine, recently appointed as Australia's first Deputy Chief Medical Officer for Mental Health, share her insights on the impact of COVID on mental health, and Colac Area Health CEO Fiona Brew, who will look back on the work completed by her service during the COVID outbreaks in Colac and the value of partnerships. We wanted to ensure that you do not experience any hiccups with the internet tonight, so much of what you will see this evening has been pre-recorded for you. You'll be able to send us questions after the meeting tonight, and we will ensure that we will respond to you in the coming days. Thank you. I hope you've all poured yourself a long drink, warm or cold, and you're ready for the evening. So let's get started. First of all, I would like to acknowledge the traditional owners of country throughout Australia and recognise their continuing connection to land, waters and culture. We pay our respects to their elders past, present and emerging. I would like to welcome everyone who's attending, particularly the representatives from the Department of Health and Human Services, Corangamite Shire councillors, Kate Macon and Jamie Vogels, our Life Governors, and of course all our staff and our community members who are here. I would like to start by asking to move the minutes of the annual general meeting held on the 14th of November 2019 to be confirmed as a true and correct record. Can I have someone move them? Thank you, Beck. Second them. Thank you, Steph. Carried. Show of hands. Thank you. Been carried. No new business has been received 7 days prior to the annual general meeting in accordance to the bylaws. We have been tested in so many ways over the last 12 months, having first to cope with the cyber security attack late last year and then COVID-19 outbreak earlier this year. A year where we needed strong leadership and swift action, and I'm pleased to say that is exactly what we saw and continue to see. We have adapted to very interesting and difficult times and have come out the other end much stronger and technically more savvy, with stronger partnerships and much more collaboration on so many levels. Our vision, purpose and values are what continue to define us. As a multi-purpose service, we are all about the community, with people at the heart of all that we do. And you will see that we continue to live our values daily. Our values being integrity, showing compassion, being accountable, always respectful, and excellence in all that we do. As one of 7 multi-purpose services in Victoria, TDHS was established in 1998 by both Commonwealth and state governments to provide a range of relevant services for our rural and remote communities close to home. They were designed to give rural people access to low-level acute services, residential and community-aged care, primary health and urgent care services, recognising that more complex and specialist services would require more advanced specialist treatment at higher level facilities. One of the greatest benefits of the MPS model is that it enables us to reach out to the communities that we serve and allow them to have input into the services provided, which best reflect local needs. And in fact, many of you participated in the independent and comprehensive needs assessment we completed 2 years ago through the online surveys, workshops, and caravan conversations we set up to give everyone the opportunity to speak openly about their needs, the result of which translated into our 5-year strategic plan. TDHS provides a variety of health care services which include acute, community health and home-based services. We are committed to telehealth, and over the COVID period, it has been wonderful to have seen more technology used for clinician appointments. We will build on this experience and continue to leverage technology when it is best to use and when needed. During COVID, we were able to assist our community through online sessions, as social and exercise classes, for example, shifted online. And it was great to see many who started out nervous to use technology end up embracing it, and dare I say, loving it, keeping them connected and well. Our services are evolving and they continue to reflect the needs of the community, with areas such as social work coming on board, which we introduced over the last few months. The TDHS catchment area stretches from Cobden in the north to the Great Ocean Road coastline, incorporating the towns of Timboon, Cobden, Nullawarre, Peterborough, Port Campbell, Princetown, Simpson, and the tourism sites of the 12 Apostles. That's approximately 7,500 people, residents, with an additional 5 million tourists visiting us each year. So last year we treated just under 1,200 patients in urgent care, with over 12,000 hours of service delivery to the home. Our wonderful kitchen cooked up over 16,000 meals, and 1,500 hours of primary care was delivered. We might have been in a pandemic, but we remained focused on community health. And we've grown our communications to you all to ensure everyone is always aware of what is happening, focusing ourselves on community health and community stories. We varied our delivery methods to ensure that we reached all of you in the place you felt most comfortable, be it through newsletters, local newspapers, social media, our website, and so on. So let's look at some of this data. Our quarterly newsletters were revamped, focusing more on community stories, and we've had great feedback with a new look. We've transferred our monthly updates to video blogs, which I'm sure all of you are familiar with, and they've been a huge success. Our Facebook likes have grown from under 1,000 to over 1,600, and we've uploaded 23 YouTube videos for you. Our sessions have gone up to 24,500, and our views on our website are now just under 100,000 views. We thank GBM Technology for all the support that we've had in making this a great success for our community. We are so fortunate at TDHS to have such a wonderful, skilled board. As a board, we've also had to adapt to the new world of technology, and as a result, have not met face-to-face up until just now in December. All of us getting online to attend the monthly board and committee meetings. I want to thank everyone on the board for working through every challenge we faced together and the support I have personally had and I've personally felt over the last and challenging months. Josh Mackenzie's term ended at the end of June 2020, and I want to thank you, Josh, for your wonderful support and your service to TDHS. He kindly agreed to remain on the Audit Committee as a community rep, a great addition to the Audit Committee, which he had been chair of. Claire Murphy, Chris Stewart and myself reapplied after 3 years on the board, and we were all extended for an additional 3 years. We welcome 2 new board members to our board of directors. Steph and Alison both live locally and have added additional skill sets to broaden the skills base of the board. Again, because of COVID, we welcomed them both online, and the transition was seamless. With the 11 members on the current board, we are very fortunate to have a diverse skill set and a passionate team who are truly committed to our health service. We have celebrated many achievements in this last 12 months. First of all, I want to focus on the appointment of our Chief Executive Officer back in November. Beck formally started last year, and we've seen a lot of leadership coming from Beck, which has seen us through these difficult times. We've had a continued focus and commitment to ongoing safe patient centre care during cyber incident and COVID-19. We've purchased the reclining lift chairs for patient rooms from our 2018-19 annual appeal, a great addition, and thank you. And we've also started to upgrade our physio gym equipment from the current appeal that we have. We've had new appointments, the Corporate Services Appointment and Community Health Manager, both reflecting a community-centred approach in all that we do. And we celebrated the Heart of TDHS Awards for the 2nd year running. As well as those achievements, we can celebrate some other things. As a service, we have embraced technology. Board meetings, partnerships, recruitment, communications, board induction. It was very much business as usual and an opportunity for business transformation in the future. And COVID and the many communications online that developed have given us a stronger voice, an opportunity to build stronger relationships and stronger collaboration across the Southwest region and with the department. The annual appeal is very important to TDHS, and it complements the already extraordinary contribution made by community members and the organisation's army of volunteers. With COVID restrictions causing a huge financial stress for so many, we questioned whether we would even hold the appeal this year, but after consultation with the Community Participation Committee, it was decided that we would ask, and what a result. In such difficult and adverse times, it looks like the current appeal will be one of the biggest appeals yet. Our annual appeal so far has reached over $22,000, which has gone towards purchasing various pieces of well-needed gym equipment for us all. There are so many people we would like to thank, and we'll start with our fantastic and dedicated staff. Your dedication and your commitment has been inspirational to us all, always thinking of others and ready for all that came your way, especially during COVID. We want to thank our volunteers, our donors, partner organisations, and everyone who works to support us here at TDHS. I want to thank our medical officers, our specialist services, our doctors, our allied health professionals who work with us. And of course, our community, your kindness and your support always there for us. I've already thanked the Board of Directors, and I want to also thank the support from the Department of Health and Human Services and the Department of Health. We value our staff and our strong partnerships, the continued community support, and the collaboration with other regional and local organisations and services. Now I would like to move to the various committee reports and speakers. All of these have been pre-recorded for you, and I will return at the end of these presentations. Thank you, everyone.
Good evening, everyone. My name is Anthony de Jong, and I'm the Chair of the Audit Committee at the Timboon and District Healthcare Service. First of all, I'd like to thank Josh McKenzie, who was Chair of the Committee through until March 2020, for all his work and for a smooth transition. The Committee comprises of all members of the Board of Directors, along with 2 consumer members. I'd like to thank Matt Hoffman and Jason Chuck for their contribution as consumer representatives during the year. To commence, I'd like to provide you with a brief update on the 2019-20 financial results. Our first slide shows a 5-year history of the financial performance of the health service. As you can see, that in 2020 the net result was a deficit of $402,000, which means that the net assets now are just under $16 million at 30th of June 2020. If we exclude depreciation and amortisation, the surplus would have been $471,000. A significant portion of the depreciation relates to the buildings, which are ultimately funded by government. Of those areas where we have direct control, a financial position just better than break-even was achieved. This is a good result for the year. Income and expenditure both increased modestly. Additional costs relating directly for the preparation and management of COVID-19 of $57,000 were incurred, with $43,000 of this being reimbursed by 30th of June 2020. The difference was received just after the end of the financial year. We have incurred a further $115,000 in this financial year since 1st of July 2020, which includes the support to the Colac Area Health. Some of the capital works scheduled for 1920 could not progress as programmed due to the restrictions to access, and these will be progressed as restrictions ease during the coming months. Overall, the health service is in a strong financial position. particularly when compared to other similar health services. This slide shows some of the key financial indicators that are reported to government and shared across all health services. The operating result, noting the exceptions from earlier, recorded a surplus of $471,000 against the break-even target. We expect to be closer to the break-even target in 2021. Trade debtors and creditors are both within targets and indicate a consistent stream of income and outgoing cash flows. Our cash position is strong, and this is reflected in the adjusted current asset ratio being above the benchmark of 0.7. In relation to donations, this community is particularly generous towards the hospital and health service. In the year, despite all the challenges faced by our community, the appeal continued to raise important funds. This has enabled the service to purchase much-needed reclining chair lifts for the patient room and gym equipment. On behalf of the board, we thank you. The next 3 slides are in relation to the Audit Committee. The aim of these slides is to articulate to you how the board and Audit Committee work together, including the aims, objectives and coverage of the Audit Committee. In addition to the financial performance which the Audit Committee oversees, the work of the Committee is governed by an annual work program aligned with the Audit Committee's terms of reference. The work program includes standing items for discussion at every meeting, as well as specific items. The standing items discussed at each meeting include financial reports and updates from the internal and external auditors, internal audit progress reports, and risk management assessments. The committee also considered the impact and action plans in relation to the IT security issue in 2019, which affected many health services, and the COVID-19 pandemic, which commenced in early 2020, both of which were managed extremely well by staff and management. During the year, the committee reviewed and approved the risk attestation for 2018-19, updated the risk register, the risk management framework, updated the risk management policy and the associated procedures. At each meeting, the committee monitored management's implementation of the agreed audit recommendations from each of the internal audit reports. In relation to the signed financial statements, the financial statements have now been tabled in Parliament. The process of bringing the financial statements to you involved preparation by staff from the health service, reviewed by the Audit Committee, approval by the board, and issue of the audit opinion by the Victorian Auditor General's Office. The financial statements are part of the annual report and now become a public document. Finally, I would like to thank staff and management led by Beck for what has been an extraordinary year. Thank you.
Good evening. My name is Toinette Hutchins and I have the privilege and the pleasure of holding the current chair position for Timboon District Health Services Clinical Governance, Quality and Credentialing Committee. And tonight I'm going to provide a very brief overview of what this actually means. So what is clinical governance? Well, clinical governance is a set of relationships and responsibilities that are established by the health service to ensure quality patient care. So what are some of the things that underpin this? These are things such as having set structures to clarify responsibilities. We have a strong leadership, policies to guide practice, and we audit our practices against these policies. Staff work within their scope of practice and to a high standard, and we foster, encourage and promote training, further education and professional development. So what then is good governance? Well, good governance is the process of decision making and the process by which decisions are implemented or not implemented within an organisation. They have 8 major characteristics. These characteristics include participatory, consensus orientated, accountable, transparent, responsive, efficient and effective, equitable and inclusive. And how do we ensure safe quality care? Well, we ensure this by constantly monitoring, evaluating and improving and striving to improve at all times. We gather information from things such as the Victorian Healthcare Experience Survey, so patient experiences. We also gather information from our team experiences, staff training, meetings, feedback, our People Matter survey. We also ensure that committees feed us with information and provide information to us. This includes the Patient Safety Committee, the Consumer Participation Committee, and our Clinical Governance, Quality and Credentialing Committee. And we ensure that we adhere and abide by regulations and legislation. Our governance and our oversight. So for effective and comprehensive monitoring of clinical governance, quality and credentialing at Timboon District Health Service, the Board of Directors receives regular reports from the following committees. These are the Patient Safety and Quality Committee, Medical Consultative Committee, and the Community Health Committee. So some of the achievements for 2019-2020 have been the implementation of the Quality Account Calendar. We have implemented and maintained accreditation action plans. We've implemented clinical audit schedules and embedded this as part of our operating cycle. And we have embedded the Timboon District Health Service dashboard to track and measure as part of our board and executive operating cycles. This ensures that we receive constant, timely feedback and information. And to just finish, I would like to deliver what I think is a perfect way to sum all of this up. It's a quote by Sir Liam Donaldson from the World Health Organization Envoy for Patient Safety. To err is human, to cover up is unforgivable, and to fail to learn is inexcusable. Thank you for your time tonight. Enjoy the rest of your evening.
Thank you. 2019-2020 has been a big year, not just for Timboon District Healthcare Service. In 2019, we had the cyber incident, which knocked out our internet and our patient electronic systems. In 2020, we've had COVID-19, which has changed many of our services. I want to thank all the community for their patience and understanding, as they've had to bear with us through COVID-19. This year, we had to slow down our exercise groups and cancel our social support groups. We also changed our entrance, and everyone's had to be screened and minimise visiting. We've had lots of extra support through our volunteers and the community in general. So thank you all for making this year bearable. Whilst we've had a challenging year, we've also had some major successes. The health service kept running, and we've also managed to increase some of our services. This year we saw social work, diabetes education increase, and we've also been working on getting a physio and a podiatrist. We haven't quite had much success due to workforce shortages, but we've got some plans to see additional physio and podiatry next year. We've also got a Director of Community Health this year to support the ongoing growth of community health at Timboon. We've done a lot of work in closing the loop for community feedback. When you ask, we listen. We think that there's a big room for us to go in relation to increasing community health, but we have all the supports and systems we need to get that going in the next few years. We've also done a lot of work this year on our values. Our values are I care, integrity, compassion, accountability, respect and excellence. We hope that you see them every time that you come here. We're doing a lot of work to support our staff and help them feel like this is a really supportive workplace. One of the ways we've shown excellence this year is through the COVID outbreak. Whilst we had lots of changes here at Timboon, some of our fellow partners had a lot more work to do and a lot more concerns. In Colac, they had a big outbreak with 102 people affected. We went to support them through supporting an accommodation facility and sending our staff for testing. Earlier this week I caught up with Fiona Brew from Colac Area Health. We're going to go to that interview now. This is Fiona Brew. She's the CEO at Colac Area Health. Recently they've had an outbreak of COVID-19 at Colac. Fiona's here to talk to us today about what that was like for them and how partnership really helped them get through it.
Beck, look, thanks for the opportunity to speak to you today and everybody at Timboon. It's been joyful working with you. In terms of the actual outbreak, we actually had 3 outbreaks. The first one was July 17th, and that actually peaked at 104 cases. The second one, fortunately, it was a single person, and they did all the right things, but we still had to go through testing for about 800 people from that. And our third cluster actually happened later in August, and it was one of our residents who actually, a community member I should say, who actually had to have a hospital admission in Melbourne, and unfortunately they came back with COVID, and that peaked at a 39 cluster at that time. In terms of close contacts, between all those clusters, it was somewhere in the vicinity of about 700 close contacts that were affected in Colac as well. So we were the largest, and still are the largest, regional outbreak outside of Melbourne, and actually nationally as well. So it was significant, and you know, we couldn't have managed it on our own, and we're heavily reliant on partnership arrangements. So, and a lot of those partnerships aren't formal partnerships.
Correct.
They're just about working together. And I'll never forget the day when Francis Diver, the CEO of Barwon Health, because they were the people responsible doing our contact tracing. It was the Monday morning, and we'd worked all weekend and recognised that we needed to have accommodation for our close contacts. I didn't have any capacity to even look at it. We'd been asking about it all weekend from the department. Francis had also been pushing, and together that Monday morning we thought, who else can we ask? And your name came up, and Timboon, and we both felt that was the perfect option and opportunity for us. So just at that moment, not to have to be thinking about that on top of, for us, was just enormous.
Awesome. So in relation to the outbreak in the health service, what are the kind of major tasks and activities that you guys had to undertake to keep the community safe?
Obviously the testing, and we were on site testing that afternoon. So from my perspective and nursing background, you always need to know the size of the problem, what you're dealing with, and the only way you can do that is through testing and get in and really define the problem. In terms of that as well, we were responsible around letting everybody know their results. And between July 17th and I think it was towards the end of October, or end of August, we actually did over 5,000 tests during that time. The other thing for us was the majority of the workforce in the first cluster was culturally and linguistically diverse. So there were significant barriers from a communication perspective. Obviously some of those people also needed to be in accommodation, which is where Timboon became so important, and that was further enhanced during the second cluster as well. So probably in essence, testing, getting the test results out. We worked very closely with the contact tracing unit of Barwon Health. Any clinical deterioration, we provided that support. The testing model we had to be agile because we were doing it in the hotel accommodation, through our clinic, at the actual businesses that were affected, plus drive-through testing. And we were also providing, at one stage, we were actually purchasing food and distributing that as well, and a whole array of tasks, which is not typical for a health service.
Yeah. So you've alluded that to partnerships and that you all had to work together to make it work, because it was a very big task, like you said, and it's not very usual for us to do some of these things. What partnerships existed prior that really helped us move forward in this space?
Look, I think there is no doubt it's always at your leadership top, CEO to CEO. And for me, I just think you can never do these jobs on your own. Every health service is part of a system. And until we absolutely fundamentally understand that and believe that as a system-wide, there will continue to be some challenges in that. I think most definitely between yourself and I, from that perspective, we both absolutely get that. You pick up the phone, you need this, you share information, you share resources. I think corporate knowledge and intelligence, years ago everybody used to hang on to it. I think it's just an absolute waste of time. You operate like that, and whatever we can do to help other people and each other, you do. You know, it's public money. Let's use it effectively and efficiently.
Yeah, agree.
So they're easy conversations in that sense.
Yeah, and I think also we have some formal referral pathways in the sense that we've got a regional DMS who supports us but sits here with you guys, and we take allied health from you, which I think you and I have a very good relationship and we can rely on each other, but when it comes down to the practical stuff, you know, staff members felt a little bit comfortable coming here because they kind of knew some of the staff when they came to help. So I think all of that adds to the dynamic of working together.
Absolutely. And I think that's the same with us, with other health services, that we rely on services from Barwon. So then that's the system approach coming through.
Yeah. With the systems approach then, I think when we first said to some individuals that we were going to go be helping at Colac, people worried because they were like, oh, are you going to bring it back to Timboon and what about us? Can you kind of explain the systems approach and how helping Colac helps all of us?
Absolutely. And Timboon absolutely helped us in that sense, but we also had other health services. So in fact, I engaged with 5 other health services. And what absolutely came out, we learnt from you and we learnt from those other health services, but then you also learnt from us. Correct. And what happened and the feedback that I got was that learnings when we got it right and wrong, and we did, you know, there is no manual on this, we all were learning that was the case, but we all reviewed our own processes and strengthened them.
Yeah.
And I think as a region then, that's put us really in good stead. And when we've seen outbreaks across the state, this region has been referred to, and the work that, yes, we did in Colac, but it's as a system we've done it.
Yeah.
And I think about, you know, we took over the accommodation from you, I think it was about August 18th, and that was just before our second cluster, and we had 59 in that time, 59 people that had to go into hotel accommodation. But you had written the procedure manual. You gave that to us. Yes, it goes through iterations because it's about continuous improvement. And then when we had finished that and Department of Justice have taken it on, all the work that Timboon did has then gone to the Department of Justice and informed how it worked. We had a mature model by the time you handed it over.
Yep.
And the learnings in that don't have to be relearnt.
Yeah,
So
nice.
I think the thing too is, typically people think, oh, it has to be the big health services that can only contribute. I think what we all discovered in that, we all had a place, and it didn't matter on your size, you all contributed, and your contribution was part of our success.
Yeah, and we all bring different strengths and skills to the table to share and resolve problems.
Absolutely.
Yeah.
And
Awesome.
having that openness was absolutely critical. There was one time I know that there were some things that we weren't doing right in the accommodation, and it was fantastic. You picked up the phone, Fiona, this is happening, we dealt with it, you know, and I was embarrassed that I can't remember what the issue was, but the nice thing is you just pick it up, you deal with it, and we move on, because it's all about making sure the patients, the residents in our community were safe, and that was the focus we all had.
Yep. Awesome. I mean, I think that speaks to our relationship in the sense that I feel comfortable to call you and say, hey, you know, we've got some problems to work on and let's solve them together. And you know,
we did.
And now I can't remember what the problem was, so that's a relief. So how do we think, you know, I think this is an incident that happened, you know, and hopefully it won't continue to happen, and we've got good safeguards in place. And so maybe just because I didn't introduce this at the start, but for those who don't know, Timboon came and assisted Colac with accommodation for those who are close contacts with COVID. So those who may become COVID positive had to be housed somewhere so they didn't, you know, potentially infect others. And so, as Fiona said, they had some difficulties getting that sorted. So we came in and just set that up and got people going, and then we very happily handed it back to Fiona once it was done. So that's a one-in-time incident. But how do you think we can continue to collaborate together for the future?
I think the trust and confidence, there is no boundaries. And what we do know now is, you know, we've talked about partnerships in the past. It's now about cluster work. A lot of what's being focused on now for me, and you know, this is from a policy perspective, is how people can have care at home and manage care at home. For me, when I look at our service, it hasn't been our strength. And you know, some of the work that previously that I've come to you and asked your guidance and support, and Timboon's what you're doing, because you have a fantastic name in community programs and things like that. There is much iterations that we need to do here at Colac Area Health, and we're going through a real transformation at the moment.
Great.
And I see that we will be knocking on your door understanding your models, seeing how we can scale those here. But there are other opportunities as well. So when you look at the cluster work, what in that can we work together on?
Yeah, economies of scale, right? How do we capitalise for each other, for our communities?
Absolutely. Yep. And if you can keep your community in mind at all times, you can do no wrong.
Yep.
And I think there's that willingness to do it. And I think it's an exemplary willingness in that sense. That they're not difficult conversations, it's just how do we do it, and what can we do, and some of it is really about scalability, what we can do, but also what are we doing that's helpful to you.
Yeah, great. Thank you so much for your time today, Fiona, and for all your efforts and working together. I think I speak on behalf of the region. Thank you for stopping COVID here at COLAC and working to really tampen that down as quickly as you did. I think it could have got out of hand more than it did. So thank you to you and your team for your effort. Thank you for making us part of it and utilising our skills where we could. And thank you for sharing with our community.
Oh, look, thank you. And I really need to emphasise that for us, it was many weeks. I think I had one day off in 25 and long hours. And to know that accommodation was in safe hands was a huge burden for me personally and for this service and this community, knowing that it was being well established, well run, it was a safe model, but there was escalation points was enormous, and I just can't overemphasise, and the community should be incredibly proud of what Timboon District Health Service achieved, so thank you.
Great, thank you.
I'm the Consumer Participation Committee Chair. COVID restrictions this year have made it interesting in the sense that we have only met face-to-face twice, and the remainder of our bi-monthly meetings have been via WebEx. I'd like to congratulate my members on how well they have adapted during these challenging times. Gabby Theologus has had to step down, and we wish her well with her treatment, but I would like to acknowledge her incredible work that she has done to incorporate the schooling community into TDHS. In the interim, Alan Pobry has stepped up into Gabby's role. Also this year we had Bobby French join us mid-year. But the purpose of the Consumer Participation Committee is to provide a strategic advice from a consumer, carer and community perspective to ensure that TDHS hear directly from and works in partnership with the communities it serves. We were established in October 2016 and we meet bi-monthly. Our achievements for 2019 and 2020, we have helped with the brochure review as well as the quality of care calendar review, and we provided consumer feedback and input to the TDH services and TDHS media as well as the website. The website has been reformulated this year and it's easier to negotiate and more consumer friendly, and Sabine McKenzie has worked wonders with our social media in respect to Facebook and our quarterly magazine. I encourage everyone, if they do social media, to have a look at our Facebook site. There's a stream of information out there for the community and some lovely recipes as well. I won't say much more. It has been a tough year for everyone. I would just like to congratulate getting through it this year, as I know it's been tough. I wish everyone a Merry Christmas and a Happy New Year, and I hope 2021 is a lot better than it has been this year for many people. I would request that the 2019-2020 Consumer Participation Committee report is accepted. Thank you.
Hi everyone, thank you for being here, and we're delighted to have Australia's first Deputy Chief Medical Officer for Mental Health with us today at our AGM. Thank you, Ruth.
Thank you.
Ruth provides policy advice on critical mental health issues impacting the Australian community due to the COVID pandemic and champions Commonwealth policy development and implementation activities to better integrate the Australian mental health system. Ruth is a consultant psychiatrist and has more than 25 years' experience She has worked for the Victorian Department of Health and Human Services and has held positions Chief Psychiatrist and Director of Mental Health. Ruth also holds a Bachelor of Medicine from Melbourne University, a Bachelor of Law from La Trobe University, and is a Fellow of the Royal Australian and New Zealand College of Psychiatrists. Thank you so much, Ruth, for joining us today.
It's my absolute pleasure, Marianne. Good to be here.
Yeah, we really appreciate your time. So what I wanted to do was just kick off with the first question. Are you able to tell us a bit more about your role with the Department of Health and how is this building on what you've done in the past?
Yeah, thank you. Look, firstly, of course, I was very fortunate and indeed very honoured to take up this role, and it really came about because of COVID. I think very early on people realised that the impact of COVID was going to be not just to do with infection control and vaccines, but that there would be significant impacts on people's mental health and indeed on people who experience mental illness, and that might go for some time. Yeah. So the role sort of grew out of COVID, but I think it also came at a time when lots is happening in mental health. I'm sure the people of Timboon are very aware of mental health issues, and that the service system is not always as good as it should be, and not always as accessible as it should be. So that's where it sort of built, I guess, on my previous experience working in a large health service in Victoria, as well as working in the department. And I had previously had some experience working nationally, so across jurisdictions. So both my previous employment experience, but also the current circumstances led to this role being created and me being offered it, and I was thrilled to take it up.
Fantastic, thank you. Now, there has been a huge impact on Melbourne with COVID, and we hear about that in the news constantly, but it's also impacted our rural and our regional communities. Is there any research out there that shows how it's impacted sort of the different communities, Ruth?
Yeah, no, look, that's a hard question because there's certainly a lot of research going on, a lot of surveys going on, and being done by a number of areas, but it is a bit harder to break that down by smaller areas. I think, you're quite right that in Victoria, metropolitan Melbourne had greater restrictions, but of course those restrictions absolutely impacted on the livelihood of people in country and other areas, and of course across a whole range of industries. So I can't give you a good answer because I don't want to tell you any lies, but I can say that the surveys have found that it's not just people in metropolitan Melbourne. There are also people very much affected in rural and regional, and probably one of the other things that has been highlighted has been a differential impact on younger people coming up with more anxiety, more worries about their mood, worries about their future, worries about how they're going to access training and career, and of course that's equally so for people in the country.
Yeah, no, we've seen that a lot. So yeah, it's interesting. We'll be very interested in the research if there's any that comes out. What do you think the long-term impacts of COVID-19 are going to be on mental health?
It's a bit of crystal ball gazing, that isn't it? But because it's a bit hard to know how long the tail is. Yeah. But just, I think we saw an immediate impact, and I've touched on that already, of people being more worried. Some of the particularly emerging illnesses included things like eating disorders. But I think the initial impact was also greatly softened by things like JobKeeper and people being able to continue to have an income even though their employment had gone wobbly. Longer term, again, people's resilience and people's feelings of happiness or hope are impacted a lot by socio-economic factors. So I think in the longer term it does depend a lot on how Victoria and how Australia comes through the recession, how quickly people do get back to employment, how much we can get back into sort of post-COVID normal. But I think anyone would have to assume that there will be longer term impacts. Some research has modelled that there will be increased rates of self-harm and even suicide. We have seen some increased presentations to emergency departments and others with self-harm. Thankfully, we've not to date seen any increase in the rate of suicide, although I'm sure you and I would agree that it's way too high already.
Yeah.
But that's something that I think many people are interested in looking at and thinking what are the sort of social supports, the use of family connections to try and make people as resilient as they can be during this long tail of the COVID impact.
Just on the suicide rate, we don't seem to hear too much about that. It seems to be like a taboo subject, yet the numbers are so high, aren't they? You know, compared to, say, other things like, you know, people dying on our roads. You know, we're hearing more and more that they're increasing, but we don't hear much about it at all. Why do you think that's the case?
So look, a couple of answers. Firstly, I think it is much less taboo to talk about suicide than it used to be. You know, suicide, if we go way back, was in fact a criminal offence, and in some religious communities very, very negatively thought about. So really hidden. But so it is less taboo, but it is, of course, it is still difficult. And one of the reasons it's difficult is that there have been examples where if suicide is portrayed in the media in particular ways, or even glorified, that actually escalates the risk. So there is a real importance, I think, to acknowledge suicide, that it happens, that it's a tragedy, that it impacts not just the person who felt so desperate that they did that, but also that person's family and friends and broader community, and the sort of ripples of impact. So it's important to recognise the tragedy without in any way glorifying it or making it seem to be attractive, which is a risk. So it's the media generally reports suicide in a very responsible way, and there is a reason for that.
Okay, all right, that makes sense actually. So thank you. Yeah, thanks for that explanation. My next question is more around the difference between mental health services for diagnosed illness versus mental wellbeing, general mental health services. Are you able to sort of clarify that for us?
Marianne, that's a great question.
Yes.
It's a really great question because language is difficult, isn't it?
Yes, it is.
We talk a lot about mental health at the moment, probably more so than we talk about mental illness. And we don't sort of talk about cardiac health or cancer health. We talk about it as a diagnosis. So it is really important. What I will say is that all of us should strive for mental health and well-being, and that really is about getting enjoyment out of your life, coping with day-to-day stresses, having good social connection and feelings of hope for the future.
Yeah.
Some people will develop a diagnosed or diagnosable mental illness and need treatment specifically for that. And the treatment for, let's just say, the treatment for an illness like depression is very different than the treatment for an illness like an eating disorder, or the treatment for an illness as like a schizophrenia or a bipolar affective disorder. So there are very clear illnesses that require and respond well to treatments that are provided by psychiatrists and psychologists, but there is, for all of us, for the whole of community and for all of our life, a real importance in mental health and wellbeing. But I'd sort of say that mental health and wellbeing services are things like your community activity and your social groups and how you how you manage your interpersonal relationships, whereas mental illness is most often something felt deeply personally and often very internally, and that certainly can influence your view of the world and yourself and your future.
Okay, all right, thank you for that.
I hope that made sense.
Yeah, it did. So is mental health more related to genetic, or is it something that can come upon you?
Like the nice answer to that is it's multifactorial. There is no doubt that some illnesses, perhaps particularly the severe ones, like a very major depression or bipolar affective disorder or schizophrenia, or some of the substance misuse, alcoholism, there's no doubt that many of those do have a genetic basis. But I think that we also would say that one's life experiences, particularly of trauma or abandonment or being exposed to family violence, that they have a major impact on how a person develops their sense of self and their sense of who they are, and therefore how they cope and react. And it's often those sort of presentations that respond better to psychotherapy than to medication, but very often you need both.
Ruth, it seems that regional Victorians are overrepresented when it comes to mental health issues, especially the numbers we're seeing in suicides. Why do you think that is?
Yeah, Marianne, it's a difficult question and a bit of a difficult answer. I think there's no doubt, I think, that there's concern among particular groups that might be at risk, and clearly we hear a lot about people from Aboriginal and Torres Strait Islander communities, remote communities that are at greater risk, and that may well have to do both with intergenerational issues, but also their social isolation and lack of social supports sometimes, and particularly in very difficult times in the country, like during drought. We worry a lot about young farmers and others, so that there's a particular response to events. And I think from time to time there's also been real concerns about a number of young people dying by suicide. But I think it's, if you look across the board, there are groups at higher risk, and it's not just in the regions. I mean, I think there are communities or age groups or people with particular histories, but it is more obvious in regional communities. People hear about it, they see it, they often know each other, much more. So I think there's both a reality to some groups being at higher risk, but also there's the perception and the experience, and I think it's often much greater in rural communities, and it rocks those communities, and it makes those communities really need to come back to their sense of community and really look after each other.
So Ruth, what do you see as the greatest single barrier to positive mental outcomes?
Well, the first thing I'd say is that we in Australia, we're pretty lucky. By and large, we've got a good climate, good quality of life, and much to be thankful for, I think. But I guess what I'd say the biggest barrier is just how important our early life is, and that means parenting and families. Now, not everyone would agree with that. If we had a competition for what's the most important, but for myself, I think getting a good start within a loving family and a nurturing community is the most important thing to get you off to a positive mental health in the longer term. And maybe country communities are really good at that.
Yeah, it's interesting, isn't it? Because we're living in a more affluent society where the incomes are higher, everyone's getting an education, a decent education, yet we're seeing mental health on the rise. And you wonder, with the resilience of young people coming through, really without the worries that probably our parents had, the concern and the questions I'm always asking is, why is that the case?
Yeah, no, these are bigger questions than you and I can answer. Yeah. I do think that at times of adversity, people actually often pull together, and I think if people feel like everyone's in the same boat and everyone's having the same experiences, that is helpful. I think young people have got some real things to worry about. They're worrying about climate. They're worrying about whether the political process looks after them. Feeling a bit disengaged perhaps from some of our political processes, but. I also think that there's some great stuff going on, and it's really good to see youth workers and youth peer workers in some of our services, and I think we're also getting a lot more mental health support and education about mental health and well-being, and indeed mental illness into schools, and that's a good thing too.
Yeah, no, that's what I was thinking actually as well. Having the school system embrace resilience and coping mechanisms for children that are really worried about some of these issues.
Well, and having people being able to speak up. And I think one of the things that we're increasingly recognising is that while it's great to go to your general practitioner, or hopefully you've already been to your mum or whoever first, but sometimes the person you want to speak to might be your footy coach, or might be one of the teachers at your school. And so having organisations or movements like the Are You OK Day, which is really just encouraging people to feel comfortable to ask a question and then listen to the answer. Yeah. Not just ask the question, but also make sure we've got space and time to listen to the answer. And I think it all contributes.
Are there any upcoming mental health systems reforms that will impact us at Timboon District Healthcare Service?
Well, I have to say I hope so.
Oh, good.
I mean, again,
Well, that's good news.
again, this is crystal ball gazing, but I think it is important to in Victoria we've had the Victorian Royal Commission due to hand down their report in February, and nationally there's been a thing called the Productivity Commission, written a very extensive report. It's about 1,200 pages on how mental health should be reformed across Australia. One of the key things for, not just for Australia, but one of the key things in regional and rural Australia is getting the right workforce with the right supports, and that's a real challenge. Now, I think one of the good things that's come out of COVID is we're getting so much better at this sort of stuff. You know, I'm going to present to you to
Yes.
your annual general meeting via some virtual platform,
Yeah.
and we've got much better at that, and maybe that will mean that we can get better at helping the local workforce with specialist backup. You know, maybe it does mean we can sort of really think about how to improve access to health services, including mental health services, across rural and regional Victoria and Australia. So reforms, I would like to think that people were better at recognising when they needed assistance, knowing how to access that assistance, and when they did access it, feeling they were understood and that the help they received worked. And at the moment, in this marvellous federation in which we live, we've got quite a bit of confusion about what the Commonwealth funds and what the state funds, and you know, you go to your GP and that's funded through the Commonwealth, and you go to the Timboon Health Centre and that probably gets state funding, and you know, they don't always work together as well as they should. So my sort of magic wand would be to try and improve some of that integration of mental health services, including in rural and regional areas.
That'd be great.
It would be
That'd be
great.
wonderful. Get that mystique out of it all. Now, we have many challenges in the mental health area. You've talked about some of them: the workforce, reducing stigma so people are ready to seek help. The challenges that go with, you know, farming, as you mentioned before, in times of drought or in times of flooding or fires or what have you, especially with our dairy community. You know, we see this all the time. Do you have any comments on how we as a local health service can address some of these challenges?
I'd hate to tell you how to do your business. But look, I do think I was born and grew up in a town called Mansfield in northeast Victoria, which is a little bit different from Timboon. It's a farming community, but not necessarily dairy farming. But the health service was probably one of the most important parts of Mansfield when the timber mills went off, and there was the health service still being a really important employer and bringing together the community on things like carols by candlelight and, you know, all that sort of stuff. And so I encourage your organisation to continue to make sure that it's sustainable, and you do that by making sure it's multi-purpose. You know, you're bringing in different aspects because you say we're too little for all these little islands to exist. And I also think it's really important, of course, to have good relationships with your regional neighbours, which are they Portland and Warrnambool, I'm going to guess.
Yes, yes, the southwest region. We do a lot of work with them.
So I think that's really important, and of course to support those people in the community who want to have a role in this sort of area, and that's people across health and education and community support. So
yeah, that's very good advice, thank you. We're kind of on that track, but it's really good to reinforce it for us to remember that as we look to our communities.
Yeah.
So yeah, now how can individuals support their own mental health?
Well, you know, I think again, COVID has taught us quite a few things. It's taught us how to use visual platforms. It's probably increased our use of social media, but I think it's also taught us that maintaining your social connections and maintaining the sorts of structures to your day, because often the structures to our day are getting the kids off to school, getting to work, you know, preparing the meal, and some of that went by the wayside. But I think maintaining that, you know, activities that you enjoy, social connections with your family and your friends, community organisations, a regular sleep pattern, you know, a regular dietary pattern, all of those are just the basics And then when something goes awry, when you start having very negative thoughts, or you get up with a feeling like you're carrying a little bag of cement on your back, and you just sort of, the day holds no joy, you think, oh, this isn't right. And that's when you think, I might go to my general practitioner, have a conversation, think whether I need to see a psychologist or other counsellor for a period of time, or even at times, get formal treatment and medication. So I think it's mostly, I'd say, in a very boring way, not too much of anything, not too much social media, not too much, listening to the bad news, but really maintaining your social connectedness, I think, is really important.
Yeah, I think it is as well.
Yeah.
Thank you. And it's good to reinforce that message to everybody who's listening, making sure that we stay socially connected. And I agree, actually, we've seen a huge use of technology during the period of COVID, which has been a real positive for us.
Look, and that's probably, I think my brother-in-law's a farmer, and farming can be pretty lonely work, long days out there on your own with your thoughts.
Yes.
And I think, again, remembering you've got your mobile phone now and you can pick up and have a chat, or you can text someone. People often choose to be alone, and there's nothing, I'd never be against that, but not to feel alone, which is, I think, very different.
If you had a chance, Ruth, to bring change to mental health services in rural areas, what would be your priorities?
Look, I think we've sort of touched on this in a way, in that I think we have to accept that a town of 800 people is not going to be able to have the same range of services, health services, as a city of 4 million people. That's just not going to. But that shouldn't mean that there isn't an ability to access the same level of service when it's needed. And so if I had my way, the really big things would be around, as I said before, really integrating services, building up the relationships within local communities with those broader centres, and workforce.
Yeah. Well, our catchment area is about 7,000 people, and we also serve the growth around the travellers, the tourists that come across. So it's quite a large group. But you're right, we need to get connected, and we need to build the collaborations, and that's what we're in the process of doing, and get stronger and stronger, and leveraging the technology, I think, now
that's
that
right.
we know the technology works.
We're much better at that now.
Yeah. Is there anything else we should know about mental health in Australia?
Well,
a 2-second answer.
Well, look, I do, as we touched on before, I think language has made life a bit difficult in this area. We talk about mental health in this generic way, but mental illnesses come in lots of different shapes and sizes. They're very different in children and young people than they might be in older people. And so I think, what else should we know? We should know that that mental health is a really important part of health. And that I should add that physical health and mental health often are closely intertwined. We still have a really sad statistic that people with severe mental illness die on average 15 to 20 years earlier than those who don't have a severe mental illness, for a whole range of reasons. So increased awareness, increased sort of looking out for other folk, for other people, and an acceptance of people's vulnerabilities, and without discriminating or carrying stigma, because there's still quite a bit of discrimination and stigma, particularly against people with very significant mental illness. So, we've still got a bit of a ways to go. Yeah.
And one of the mothers in our community came up to me and mentioned that her 16-year-old fell in between the cracks. She highlighted that, we've got a lot that we can do for children, and there's a lot that we're doing for the adults, but if you sit right in the middle there and you're suffering from mental illness, there's an issue. Is that something that's being addressed?
Well, look, it's interesting that you say that, because in some ways the investment in young people, and that's people sort of aged from 13 to 25, that's been a real focus through the Headspace centres, and there are about 150 of them across Australia now, and that's a lot. It's a lot of investment in youth. But the thing, of course, is to get people to go to the centre, and for the centre to be able to respond. So what I'd say to your friend is, look, there is stuff out there. The check out Headspace. There's also e-Headspace. But I think young people, of course, can be very isolated, and in fact, social media can make them more isolated. And we've all heard about bullying and harassing and very negative comments through some forms of social media. So the other thing I'd say to your friend is for her or him to keep a really open ear to the young person in their family and be available and be ready to listen, and even when you hear things that are disturbing, say that's okay, we can talk about it some more.
Yeah. Ruth, there's so much more we could talk about today, and I know we're limited at time and it's our annual general meeting, so we're going to reuse your video clips, I think, for other events that we have around mental health. But it's been wonderful, actually, just opening up this conversation around mental health and giving us an opportunity to understand it better and to understand your role. So thank you very much again.
No, my pleasure, and go well, Timboon.
Thank you. Thanks very much. Thanks,
you.
Ruth. So thank you, everybody. I'd like to go through the presentations with you now that they've ended, and I request that we motion that the board chair report be accepted and seconded. So thank you, Beck, for accepting it, and Ashley for seconding the report. Everybody in favour? Thank you. I'd now like to motion that the audit committee report be accepted. Thank you, Bryce, and seconded by Steph. Thank you. All in favour? And lastly, secondly, I'd like to go through and motion that the clinical governance and quality and credentialing report be accepted. Motion by Beck and seconded by Chris. Everyone in favour? Thank you. And lastly, I'd like to motion the acceptance of the Consumer Participation Committee report. I want somebody to move it. Thank you, Fiona, and seconded Steph. Thank you. Everyone in favour? And sorry, Tanya. Tanya was moving it. Thank you very much. Right. And I can't go on to the next screen because I'm not... So we've come to the close of our AGM, and as I mentioned before, if you do have any questions, please make sure you send them to us and we'll respond. And I'd also like to advise you that our annual report has just been printed and will be made available to you if you want it from next Tuesday. And also the Timboon and District Healthcare Service Quality Account Calendar that you heard about from Heather earlier, that has been made available. So anybody that wants either of those reports, please let us know and we'll send them to you, or you can come and collect them at the service from next Tuesday onwards. Now, if anybody wants to re-watch any of this presentation tonight, you will be able to re-watch it on your Facebook link, the link that you've been using, and we will post it to the website as well. This production has been brought to you by Fitz Media, and we thank them for all the work that they have got, that they have done. And that was helped by the team at TDHS, in particular Sabine McKenzie, thank you Sabine, and also Rebecca McAuliffe, thank you. And Glenn, thank you from GBM Technology. The message from Ruth was clear. The power of self and kindness is the key to navigating our way through life and mental well-being. We have the capacity to find that joy that often eludes us when we get so busy that we forget to look. Feeling gratitude and empathy are core to our own well-being. Let's work together to stay safe over the holiday season, and I encourage you all to find your joy, whatever that might be, and maybe help others find theirs. So, as I end the AGM for 2019-2020, I want to wish you all a Merry Christmas, a Happy New Year, and a very safe holiday. Thank you everybody for your attendance, and I look forward to working with you all next year. Thank you.